but I know about the company. Fathima is a founder of Sollu Pvt. Sollu is a Tamil word called Sollu, yes, actually, okay. So they started this company in 2016, and Fathima founded Sollu. It's a very innovative customer engagement or call center management. A lot of call centers companies are there, which is not industry specific. Multiple industries are there. This particular company focuses on healthcare call center, and they also started with patient engagement. Later, evolved to customer care listing. And she has a strong background in technology and multiple management roles. Past 15 years, bachelor's in IT from Madras University, and also from USA. She has worked in Deloitte Consulting. Happy to hear that. She worked a lot with Deloitte, and she received a lot of awards, especially also the AHP award is something very prestigious, I consider. And Women of Worth from Outlook magazine. Sorry, no problem. I've done your job, sir. Okay. So now let's listen to Fathima and Sollu. In the last 6 years, Sollu has evolved into a beautiful product, and I'm sure that it will fit into all your requirements for patient engagement.
So I think patient engagement could not have been explained better. Dr. Manila did an amazing job of actually explaining what patient engagement is all about. So today I'm here to speak to you about the technologies that can help better patient engagement. So before that, let me give you a small history behind how we got into this space. So maybe like 10 years back, we got into the area of teleconsultation. It was way beyond its time, right? So it was much before. And when we did go to hospitals, we noticed that both the doctors as well as the patients were not ready to go to teleconsultations. This is a decade back. However, we started noticing that there were many places, many pockets, where there is communication engagement happening with patients that is being overlooked. And we noticed what is the first point of contact in a hospital? It is when the calls come in. It is when the patient, after they go back to the hospital, what happens next? How do you get the feedback from the patient? All of these points have beautifully been covered by Dr. Manivanan as well. So I will take you and I'll just explain the key areas in patient engagement and then get the actual products and technologies that we can use. So what is patient engagement actually speaking? Very simply put, patient engagement is nothing but involving the patient in their own care. That's it. In getting the patient to be involved in their own care is patient engagement. And how do we do that? Now, what are the benefits for patients? Education regarding the condition that they have, the risks that they have for certain diseases, that is being educated to the patient. Today, the doctor, especially in India, does not have the time to explain all of these multiple times to every patient. So this is automated and the education is provided to the patient. There's improved care for the patient because using multiple apps, they're actually able to identify the risk factors and weather issues for the patient, and they're able to provide care right there rather than wait for the patient to come to the hospital. Treatment adherence. So the patients are provided a care plan, they provide medicines. However, you really know if the patients are adhering to the particular care plan or having the medicines on time. So patient engagement products and apps actually enable them to adhere to their treatment regimen. What are the benefits for providers? So this is the question that everyone would ask. The hospital owner, you would ask, what is it for me? Improve retention rates. Initially, you will not notice that increase retention rates, but as you notice, the number of appointments with the patient, the hospital has increased by like 30%. Right? There's increased patient satisfaction. By putting in a feedback system where you have the incentive to actually fix the problems immediately, we have seen Google ratings go up by 2 points within 3 months. So there's increased patient satisfaction there. And the ability to serve a large population with limited resources. The doctor-patient ratio, in India is very huge. In spite of that, if we can use the same resources to reach out to multiple patients at the same time, so that is an extremely big advantage. So this is how patient engagement actually started out. So first, especially it started out in the West, it was terminology that was used in the West. So the insurance providers actually used to pay, and I think currently also to pay for procedure. However, in the West, they noticed that suppose a patient has come in for a knee surgery, and then they go home, and then there's an infection after a few days, and then they have to come in, and then they have to do another surgery because of the infection. There are two surgeries, and the insurance company has to pay up for this. However, if the infection was caught beforehand, if the patient had come into the hospital right then and rectified it then and there, the second surgery would not have been required. So there was a shift from fee-for-service to value-based reimbursement. So the hospitals were actually incentivized to ensure that the patient did not come back for a second surgery. So they started sending messages which are very personalized to every patient. So if a person did a knee surgery today, on day 2 and day 3, they would get a message saying, you see swelling, and if the swelling is there, is the swelling red or is it yellow? In case it is yellow, they are asked to come back to the hospital for a checkup. And this way, they actually prevent the second surgery from happening. Also what is seen here is there's a measurement that takes place. So the measurement here is a 30-day readmission. So they do not want a patient who has been discharged to be readmitted within 30 days. And in order to do this, the hospitals needed to start engaging the patients in their own care so that they don't get readmitted, otherwise they are penalized for the same. So this is how patient engagement 1.0 started, like around 10 years ago. And then there was a reduction in costs. Like I told you, again, you don't have multiple or repetitive care for the patient, so there's a significant reduction in costs. And third, there is an improved quality of healthcare here because you're able to actually address more patients rather than spend most of your limited resources and time on sick patients. Then the patient 2.0. So this is where we see take up the rest of the world. So you had appointment managements coming, you had cloud-based EHR systems being adopted by hospitals. And then you had access to health records. So EHR systems were not actually being used for quite a while. Now EHR systems are being used. And now the patients, they're allowing the patients to have access to their own health records. So they can log into a patient portal and see all the data that is actually saved and was only visible in the hospital's until now. And the last, like CRM systems, we have PRM systems, which are patient relationship management systems. And these systems manage feedback, they manage the messaging with the patient as well. And then came the pandemic. So this is where everything radically changed. So where we didn't see adoption, we suddenly saw rapid adoption, both at the provider end and the patient end. Anybody who has a technology company in healthcare actually knows how this just, the entire scenario flipped overnight. Right? We had to go and convince hospitals to actually try a product. And suddenly we had calls coming and saying, how do we use this? And with online consultations going up, what we noticed is that doctors are not just going for online consultations, they immediately started adopting technology in all its forms. Right? So they were open to cloud. Initially they were not open to SaaS-based products, they were not open to cloud. But then today they were okay with the information being stored on the cloud, they were okay with the ease of use. Yeah, there was rapid adoption here. Next. The focus was on delivering care to the patient wherever they were, right? So patients would not come into the hospital, you had COVID patients in the hospital, what do you do if you had other types of procedures that had been performed? What other kind of care was to be provided? You had a small child having the flu, you didn't want to go to the hospital for fear of COVID. So focus suddenly shifted to delivering care to the patient wherever they were, and thus improved the quality of health as well again. So if you notice, in the beginning it was all about education. And then came engagement, and then came empowerment, because now you have the patient specifying what they want. The patient was making the decisions here. Leading to patient engagement 3.0. Right? And yes, that's what it is. Yes. So they wanted to connect to patients from wherever they were. This is because now today patients were used to immediate gratification, right? You use Amazon, you use Swiggy, you use Dunzo. They want to open up their phone, they want access to healthcare the same way that they could actually order food. It sounds a bit crude, I understand, but this is what they, this is what everyone is going towards. And there's relevant and personalized communication today. So there's no one size fits all, which means I cannot have a message, I cannot have like 10 messages which are put together for all parents of children who are 2 years old. That's not the case. Each message should go to the particular patient, specific to their issues and specific to that particular time. For example, if somebody is pregnant and they are 4 months pregnant, in the 4th month and 2nd week, a particular message specific to that particular patient would be delivered to them. Right? And this can happen via apps, this can happen via text, this can happen via voice as well. And then we have an omni-channel approach, which also Dr. Manivan had explained earlier. So you have to be available on multiple modes of communication. And also the system would take care. For example, your first message is on WhatsApp, and you've actually communicated and got an appointment on WhatsApp. Tomorrow you call the call center. The information is available to the call center agent. Third, you actually get a text, or you get an email from them as well. So there are multiple modes of communication being used, not just one. And the patients actually expect these multiple modes of communication. Because there may be somebody who's heavy on WhatsApp, there's somebody who prefers to use their email, there's somebody who may actually just prefer a voice reminder, maybe a senior person who would prefer that. So we need to be available on all modes of communication as well. And also, once this happens, increase patient retention because they feel that there's an involvement of the provider in the entire care journey. So how do you win at patient engagement? You win at patient engagement, like we mentioned, they're being multidimensional. You need to have frequent communication, not just one time, not just one message which says, thank you for visiting a hospital. This is our phone number in case of any emergency call is back. No, that is not the case. You would have to send a message out to them during flu season. You have their parameters being obtained on a device, and you will actually know what the risk factor is towards cardiovascular diseases. Call them in for a checkup. Give them a particular offer and ask them to come in and have a health checkup. And where and when. Something that I explained earlier as well. Wherever they are, it doesn't matter, you should be able to capture the information. And strategic communications with confirmation and rescheduling options. So for example, like I said, you don't want to send a message saying there's an appointment reminder. On the day of the appointment, you send a voice message, they hear the message saying, asking them to confirm their appointment. If they're not confirming or if they say they're not able to make it, it will be rescheduled or it will be connected to the call center where they can reschedule the appointment. With an amazing patient engagement strategy, we can gain more loyal patients, drive more patient satisfaction, and increase in revenue. Now the question is, how do we do this? What technologies do you exactly use for better patient engagement at your healthcare organization? First and foremost, the most important part is the call center. If you're a small hospital or clinic, it is your front office staff. And like Dr. Manivan said, if you actually listen to those recordings, you will be shocked. You would really be shocked. It is not because that is your first contact point. This is where you need the person who's picking up the call to empathize with the patient. So you need a system where you can track every call. This very simple system would help. You need to ensure that there are no calls which are dropped or missed because the patient is calling in a state of emergency, for example, and you're not there, you're not available to them. And that is the first impression you're giving to the patient of your non-availability. So how do you avoid this? Then you ensure patient satisfaction at the end of the call. You can give a small survey to ensure that whether they were happy or not after the call. As you measure this, you can go towards a space where all your calls and all the patients are satisfied post calls. In case they are not, you train your agents further till you actually receive that number. You use automated tools to reach out to patients, telling them that you will call them back in case you're not reachable. So at least they know, they feel heard, and they know that you're going to reach out to them later. And you use a lot of AI to ensure that the call center agents or office staff are able to keep patients satisfied during the call. What do we mean by this? It is not actually possible for us to listen to every call in a call center. Or even for 100-bed hospital, they would get around a minimum of 300 to 400 calls a day. You cannot have a person who sits and listens to every call. And even if they do, what are the parameters? One person may think this call is okay, another person may think this call was, the person was rude on the call. So we use a lot of AI where we can actually measure the patient satisfaction and dissatisfaction. You will know whether words that were not meant to be used were used during the call. So all of this using AI is possible. And then throws up calls where there are issues and only those calls are monitored and the agents are corrected or they're trained further so that such issues don't happen. And during the call, you should be able to give them information about the doctor, and then information about the location of the hospital, the appointment details, over the text right during the call. So which means as the call is being picked up, information regarding the patient has to be available on the screen. In case the patient wants to speak to the doctor or the nurse department, they should be allowed to patch a call then and there. There shouldn't be a scenario where they actually ask them to call back after some time and the patient gets dropped and is unsatisfied after a while. So the most important point of engagement would be the call center for a hospital or any number that they could reach 24/7. And then the lowest hanging fruit, I would say, the greatest returns would be the post-op follow-up. Right? An example of how it's being used in Calgary Hospital is amazing. You actually saw the numbers. After the discharge of the patient, you would call up the patient. This is manual. You can have automated systems, but this a manual system. This is something that you can just set up and test immediately, right? And then you can have them call them back. You know exactly when they were discharged, when they're supposed to come back for a follow-up. Around 50% of patients who actually get discharged do not come up for the immediate appointment with the doctor, and this is where issues actually happen. This number is extremely low in India compared to other countries. Then you have, and in case if you feel manually this is not possible, you have automated follow-up messages. So the system knows that the person got discharged today, exactly in 1 week they're supposed to come back for suture removal, for example, exactly in 2 weeks they're supposed to come in for a checkup, and then after 1 month they're supposed to come in. So all of these are already fed into the system. So depending on the type of surgery or procedure, the system automatically would reach out to the patient. Also, if they reach out to the patient and the patient does not confirm, even this is alerted to the hospital, and then they could make a manual call to convince the patient to come to the hospital. You have multiple programs specific to surgeries, you have programs specific to pregnancies, programs developed by the United Nations, by the USA. A lot of programs are readily available. You can actually use them because you have multiple papers written on them. You can actually see the numbers for yourself and adopt which patient engagement programs you want to adopt. It's not necessary that you have to reinvent the wheel for every particular procedure, every particular surgery that you need to know what kind of messages have to be sent. You can take these programs from a lot of providers have these programs with them. You can take these programs, customize it as per your needs and immediately roll it out to your patients. The happiness or satisfaction that you see from the patients when they come and meet you next is unbelievable. We have heard this from so many of our clients and we highly recommend you do this as well. And then you can address post-op symptoms. This is the main, this is one of the main keys. So this is where if you're able to catch your symptoms right in the beginning, you'll be able to make a big impact. And then reminders for checkup that I've already explained. Appointment reminders. So if you see here, 27%, and 27% is a very huge number, where healthcare consumers actually miss their appointments. These are no-shows, right? How can you avoid these no-shows? You've given 15-minute slots to your patients, and then you actually have almost 1/3 of your patients who have not turned up. What do you do? When they don't turn up, you're actually losing revenue. You're losing 30% of your revenue of patients who could have come there then. So automatic appointment, some of them just forget that they had to come for the appointment, right? So what happens is you remind them the day of the appointment that they have to come and meet the doctor. You also have voice messages which can go on to them and they can confirm their presence as well. So using such products, you can actually reduce the no-shows to less than 5%. So we recommend that you can book in 5% more appointments and you will be set 100% of your slots will be filled. And yes, rescheduling systems can also track how many times they reschedule, so it actually know if the patient is really planning on coming or not coming to the hospital. Medication reminders and adherence system. 50% of the patients, and 50% is really huge. So half of the people who are supposed to have their medicines at a particular time do not actually have it the way it is being prescribed by the doctor. This in turn leads to 150,000 deaths per year. An example would be tuberculosis medicine adherence. So when they have the tuberculosis medicine regime, and we actually did a study for the Bill and Melinda Gates Foundation, and we built a patient engagement program for this. We noticed that after the second month, when the patient starts feeling better, they think they feel better, but they stop having their medicines. And when they stop having their medicines, what happens is they have another recurring tuberculosis, and which can end up being fatal as well. Using our product, we actually so we had reminders going out to the patient, actually educating them on what would happen. So exactly the second month, the message would go out to them saying that they would be feeling better. And they're feeling better, but in case they miss their medicines in spite of feeling better, what are the consequences of that situation? And also when they come and have their medicine, they're supposed to mention that they have the medicine, those simple say press 1 that you have medicine, press 2 in case you do not have the medicine. In this case, what happens, in case they say they haven't had the medicine, automated call goes to the mother or the wife or anybody else in the family. And if even they don't answer, then it goes to the care provider and finally to the doctor who goes to the place as well. So in this way, we were able to bring about 99% medicine adherence, which was unheard of before. So when we educate the patient as well as and remind them at the same time, there is a really high number in medicine adherence. And the intelligent feedback systems. Today, thanks to NABH, everybody is required to have feedback systems in place. A lot of hospitals and clinics have paper feedback systems. However, we've seen cases where paper feedback it's received from patients, they don't know where it's kept. There is no way for you to actually put this data all together. So you now receive feedbacks on tablets, you have feedback links coming to you on your phone. So these are very simple but effective ways of obtaining feedback from the patients. But the key is, what do you do with this feedback? When you get negative feedback, you need to do your root cause analysis. And you can have the system actually push that particular department to call the patient. The system tracks that they call the patient, speak to the patient, get the feedback from the patient, and take corrective action as well, which management can monitor. Again, increases transparency, provides transparency to management, increases accountability, and increases patient satisfaction as well. So those were the simple technologies that you can just go back and immediately start setting up in your hospital. You can do it manually at first and then later you incorporate products for the same. And then today, the game changer is mobile healthcare. Right? You have health apps, you have wearable devices. These devices are connected to your patient portals, so the hospital can actually monitor your vitals. Right? And accordingly, when they know you have risk factors, you actually asked to come to the hospital. The provider is alerted when your numbers are suddenly off and the patient can come in with the doctor. So preventive health measures can be implemented using mobile healthcare. And using wearables and these tracking devices, you can capture a lot of data. Otherwise, you would just be meeting your doctor during that particular slot and you would just, how much can he actually ask you about what you do or what your activity levels. But here the data is completely captured. Doctor has all information regarding your activity, your weight, and your sleep patterns and all that. And accordingly, he can suggest care plan for you. And then we have AI and predictive analytics, right? So with lots and lots of data coming in from all patients and utilizing machine learning and artificial intelligence, we're able to identify the high-risk patients and able to prevent untoward incidents from happening. We can predict the disease possibility for a particular subgroup of people, and you can take actions for them as well. There are real-time insights into their health parameters that is being captured. You also can find out what motivates that particular patient to engage. You will notice that when you send a lot of education messages, a particular patient is engaged with the hospital. Whereas for somebody only if it is actual voice calls or automated voice calls that they engage. And as you realize what engages each patient, you can reach out to them using their preferred format. And then you can track compliance. Are they actually having the medicine or not? They actually have to go and mention that they've had their medicine. You can track compliance of the treatment regime. And then there is gamification. How do you incentivize the patients to follow their care plan? So a lot of products are available in this space as well. So you can actually, for example, you may tell them if you do this for a particular month, you get something. So all of that you can have it gamified into your application as well. And you have, like the WhatsApp example that was shown, you have a lot of natural language processing chatbots. You have WhatsApp chatbots where with the data that is available, the chatbot would actually engage with the patients. You ask questions, you'll be able to answer the questions. So this is available as in the form of text chatbots as well as chatbots that can actually speak to you in the call centers and they can answer the questions that you have. And there's some patient engagement, like Maya said, they may forget your name, but they'll never forget how you made them feel. And the entire part of patient engagement, I think the entire goal of patient engagement is how you actually make your patient feel and how you make your patient feel cared for. Thank you so much. In case you have any questions, please let me know.